Good morning. My name is Matt Haney. I represent the 17th Assembly District in San Francisco. Today is National Fentanyl Prevention and Awareness Day. It was established in remembrance of the many loved ones who have died from fentanyl poisoning across the country. Fentanyl prevention advocates across the country come together on this day to take coordinated action, to remember lost loved ones, and to warn the public about the dangers of fentanyl. Fentanyl is a drug that is killing people all over our state. It's impacting every city, every county, every region. It doesn't know geographic boundaries. It doesn't know partisan lines. It is a public health epidemic that requires an urgent, coordinated, comprehensive response to save lives. Fentanyl is something that, unfortunately, I know a lot about in my district. I live in San Francisco's Tenderloin, and I have seen directly the devastating effect that this drug has on so many families. Like so many others around California, I have lost loved ones. The United States Drug Enforcement Agency now declared fentanyl the single deadliest drug our nation has ever encountered. Fentanyl is 50 times more potent than heroin, and only 2 tiny milligrams of fentanyl is considered a potentially lethal dose. Fentanyl now kills more Americans under 50 than any other cause of death, more than heart disease, cancer, homicide, suicide, or accidents. In California, almost 6,000 people have died from fentanyl overdoses or unintentional fentanyl poisoning in 2021. And this is a drug that disproportionately impacts communities and people of color. Fentanyl poison is now a huge concern for California's youth. 1 in 5 deaths in our state are now being caused by fentanyl. And fentanyl is being pressed to look like common pharmaceutical pills like Percocet and Xanax. The critical need for education on the threat of this drug and how to prevent people from unknowingly or knowingly ingesting it is critical. Our Democratic caucus is taking action. There are over 25 bills that have been introduced by Democratic legislators to confront this fentanyl epidemic. We've introduced new laws that will employ emergency responders to ensure we have a public health response when people overdose. We've introduced bills to extend Narcan to places like bars and gas stations so that it's there as an emergency intervention to save lives. We've introduced bills to expand access to treatment. The most effective treatment for addiction to fentanyl is buprenorphine or Suboxone, medically assisted treatment that, unfortunately, right now, over 80% of people who are addicted to opioids are not enrolled in. We know we need leadership at the scale of the problem that we're facing so that we can save lives. And today, on Fentanyl Awareness Day, we implore Californians to join us, and we recommit to pursue those solutions. I am going to now introduce one of my colleagues who's taken leadership on confronting the fentanyl epidemic, Ms. Kadi Petrie-Norris.
Thank you, Assemblymember Haney, and good morning, everyone. I'm Assemblywoman Kadi Petrie-Norris, and I represent California's 73rd Assembly District. We're here today because it is Fentanyl Prevention and Awareness Day. As you've heard, the scourge of fentanyl is poisoning our communities and killing our kids. Today is an opportunity for us to raise awareness about the dangers of fentanyl, the prevalence of fentanyl, and the actions that each one of us can take to keep our communities safe. So I want to leave people with 3 simple takeaways this morning. Number 1, fentanyl is deadly. And I think we sometimes call it the most dangerous and deadly drug in the nation. And I think that even understates just how lethal this is, because fentanyl is, in fact, poison. This is a pack of sugar. This packet of sugar contains the equivalent of 1,000 lethal doses of fentanyl. Fentanyl is poison. Number 2, fentanyl is everywhere and in everything. Increasingly, we are hearing horrible, horrible and tragic stories about people all across our state and kids all across our state who have been poisoned by fentanyl after taking something that they thought was a Percocet or an Adderall or an oxycodone. And increasingly, people in California and our kids are being sold these counterfeit pills on social media sites. Today, drug traffickers don't need to operate from dark corners or remote parking lots. They are going after our kids on sites like Snapchat, Facebook, Instagram. So that's takeaway 2. Fentanyl is everywhere and in everything. And then third, for parents all across the state of California, get Narcan. Get Narcan and learn how to use it. Narcan is now available across California without a prescription and free of charge. So you can walk into any pharmacy across this state, show them your insurance card or including Medi-Cal. You can get a prescription on the spot from your pharmacist and get Narcan. The scope and scale of this crisis is overwhelming. As Assemblymember Haney articulated, this is an urgent public health crisis, and we are responding with urgency. We are responding with a comprehensive approach to tackle this crisis and help keep our kids and our community safe. So thank you all for being here and for helping to raise awareness about this epidemic and the actions that we can all take together to combat it. With that, pleased to introduce someone who is leading on this issue and leading in this fight. Please welcome Assemblymember Ramos.
Let me get a sign.
Well, thank you so much. This issue is something that's been plaguing the state of California for some time now. Last session, we were successful in getting AB 1628 signed into law that would hold social media platforms accountable and would allow constituents to file a lawsuit that then the Attorney General could follow through on those lawsuits, making sure that social media platforms are adhering to their policies of what they're selling online. Last year, we also did move forward and worked with counties in the state of California to work on distribution of Narcan at the local level. These are areas that we've been working on here in the state of California. This year, we have 2 bills dealing with fentanyl and moving forward. One is AB 462 that deals with overdose response teams. This will allow county sheriffs to go into get funding through grants to start to document the data coming forward, so then it could be reported back to the Assembly, Public Safety, and the state legislature to move forward in a manner that protects our people. We also have AB 461 that will move to get test strips for fentanyl in the Cal State University system and the community college systems, and it urges the UCs to follow suit. These are bills that are currently moving through the state legislature or have been signed into law last session. And the reason why it's so important is that because per capita wise, this drug is harming and a lot of members are succumbing to the poison that fentanyl is doing in poisoning our communities. We also want to make sure that we have a voice for our tribal communities here in the state of California, that per capita wise, it's harming them more and more than any other group here in the state of California. Crisis stabilization units are still far and in between on Indian lands. We need to do better as a state of California. But we also need to make sure that we're tying all the components together, making sure that resources are available for all those in the state of California with mental health and mental health resources, that we see a high percentage of those that are partaking in fentanyl and ultimately succumbing to fentanyl, that mental health issues is a strong component that leads down that path. We also know that from the tribal communities and our communities in the state of California, that we have to be able to heal the home. If we try to heal the individual without healing the home first, then we have to make sure that all the voices within that area are also being taken into account. We also have to make sure that there's the hospitalization, care hospital, making sure that resources are there for those that make sure that we're being proactive to the situation. There's been a lot of discussion over fentanyl here in the state capitol, but this is an ongoing crisis here in the state of California, and we're going to do our best as a state legislature to make sure that voice is being heard, because again, it's poisoning our community, all communities, and we want to make sure that as we talk about resources and moving forward, that we talk about the most vulnerable that's out there, that per capita wise, that fentanyl is attacking, and that's the Native American population here in the state of California. Thank you. And right now I want to introduce Isaac Bryant, Assembly Member.
Well, good morning. Grateful to be here with all of my colleagues on this important day. Like many up here, I have loved ones who have taken substances that were laced with fentanyl. A lot of the reasons people use substances are underlying traumas, stress, anxiety. We have heard parents of victims who lost their lives who said, my child was just trying to take something for their anxiety. So as we're dealing with this as the public health crisis that it is, we have to think at a manufacturing-wide level, but we also have to think of this at the demand level. And the demand is driven by the conditions of life that are unstable for so many folks. If you want to stop young people from having high anxiety and looking for something to ease that anxiety, you've got to lower the cost of rent. You've got to lower the cost of education. You've got to increase access to opportunity. If you want to stop what's happening on our streets, you've got to increase affordable housing. You've got to close the economic gaps that allow so many people to live on the streets, craving any kind of substance, any kind of anything that'll take away the stress of that kind of trauma. So many of my colleagues across the aisle are unwilling to invest in any and all of those preventative and systemic solutions. In fact, the only thing they're willing to invest in is the mass incarceration we know didn't solve this crisis over the last 3 decades. In California, we've got an opportunity to lead. We've got an opportunity to save lives. We've got an opportunity to do a lot of good. And the way we do that is by learning from the lessons of the past and investing in care, treatment, opportunity, so that our young people, so that all people aren't looking for an escape from reality. We have to improve the conditions of reality. That's why I'm here today. That's the work that the Democratic Party is doing. That's the work that Democrats and this legislator are doing. That's the work that California is going to be doing. And these are some of the leaders of that work. Thank you. And with that, I want to introduce Assemblymember Freddie Rodriguez.
Good morning. I want to thank everybody for joining us on this very important day as we celebrate and talk about National Fentanyl Awareness Day. I'm Assemblymember Freddie Rodriguez representing the 53rd Assembly District, and I want to thank all my colleagues behind here. There's just a few of over 20 members that have introduced bills to combat this crisis. As a former first responder for over 30 years, I know the dangers, what this does to our communities. I can't tell you the numerous times I've been on overdoses and what it does to the families of those affected by these drugs. I encourage all Californians to know the signs and symptoms of an overdose and have regular conversation with their children about the dangers of fentanyl and many other drugs out there. Fentanyl, as we know, and other opioids are killing California kids, are dying from drugs that they likely know little to nothing about. The state has become a stronger partner in combating the illegal opioid crisis, including distributing the networks of criminals to get opioids drugs off the streets. That is why I introduced AB 474 to require the State Threat Assessment Center at Cal OES to support state and local fentanyl task forces. This bill will complement the governor's master plan for tackling the fentanyl and opioid crisis, which will prevent manufacturing, drug trafficking, and distributions. We must do everything in our state to protect the threats from public health. So with that, I want to introduce my other colleague, Esmeralda.
Good morning, everyone, and thank you, Assemblymember Haney, for inviting me to be here and be here with a number of our colleagues, as was mentioned, that are working on this very critical issue. We have heard fentanyl is a statewide and national public health but also a public safety crisis that unfortunately has become the leading cause of death among Americans ages 18 to 45. In my district, which is inclusive of the Central Valley Assembly District 27, from Merced down to Fresno County, this issue has worsened in the last 5 years, with the number of fentanyl caused deaths skyrocketing. In the past 2 weeks, if you guys have been paying attention, the DOJ announced the seizure of 58,000 fentanyl pills in Merced County alone, which were worth millions of dollars. So when Republicans are saying that Democrats aren't doing anything, that is false. Democrats have been working on this issue before that I got to the legislature and are continuing to work on this issue, both on the policy but also on the enforcement piece, which we know is extremely critical. I am very grateful to our local law enforcement officials, to the Attorney General, for making sure that these 58,000 fentanyl pills didn't make it to the hands of young people in my community and up and down the state of California. For this reason, we must continue to not only raise the awareness, which is what we're doing today, raising the awareness that just 2 milligrams of fentanyl will kill. And we must do more, continue to do more like we've been working on here with all my Democratic colleagues to ensure that we address the public health crisis that we have in front of us. I want to just shout out to my colleagues for this legislative session for bringing bills forward. I had one bill that made it through Public Safety Committee, and I'm looking to continue to have that conversation so that we have a comprehensive plan moving forward to continue tackling this issue that we're not going to solve overnight. But it starts with awareness, it starts with investment, and making sure that we work together to ensure that we're saving the lives and preventing additional deaths as a result to fentanyl. So I just want to tell my colleagues and Assemblymember Haney, who I know is leading also all these efforts through his select committee, I am proud to work with them in collaboration to continue this conversation, because we do need comprehensive solutions to this critical issue that is taking way too many lives up and down the state. And so thank you to all of you for the work that you guys are doing. I look forward to being able to go back to my community and tell them all the things that we're doing on behalf of them to protect our kids. Thank you. Oh. And now I have the pleasure of introducing Assemblywoman Schiavo.
Good morning. My name is Pilar Schiavo. I represent Assembly District 40, which is the North San Fernando Valley and Santa Clarita. Santa Clarita is the third largest city in all of LA County, and it's a city that has seen its fair share of tragedy due to the fentanyl crisis. We've had nearly 30 students who have been killed through overdoses, and it's something that, many people in the near future, their lives will be untouched. Their lives will be touched by this crisis. We know, as was talked about before, it just takes a little bit, right? When people are talking about fentanyl, it's 2 little kernels of salt can kill. And so this is a crisis that is touching our communities throughout the state, and Democrats are really stepping up and leading on. We have a hearing happening later this month that will be led by a joint effort by many of those here today. And we know that we have to have a comprehensive approach when we're talking about this kind of a crisis, right? We can't talk about addiction. We can't talk about overdose if we're not talking about root causes. We have to talk about what are real solutions, proven solutions, things that we know are going to make a difference and really make an impact. And those are the things that we need to focus on as a legislative body to find real solutions, because too often, and one of the reasons I ran for office is because I was frustrated with politicians who will too often do Band-Aid solutions just to have a talking point saying they're doing something. We need to focus on things that are actually going to make a difference, make an impact, and change people's lives and prevent these tragedies from happening in our communities. And so that's what I'm committed to doing. It's one of the reasons that I'm co-authoring AB 19, which would ensure that we have public schools that maintain at least 2 doses of Narcan in their schools. and are able to respond to the kinds of crises that we're too often seeing in our schools and with our students. As a mom, this crisis is terrifying. It's terrifying to me. It's terrifying to think what my daughter is going to be, facing in the near future, going into middle school and high school. And so this is something not only as a legislator am I concerned about for moms and fathers throughout our community and families in our community, also very personally as a mother, very concerned about making sure that we really take on this crisis. And so too often we talk about, a crisis here in the Capitol. There is broad consensus. This is truly a crisis. It's a crisis that we are committed to addressing, committed to solving, and committed to making a difference on in a real way. And so I want to thank Assemblymember Haney for pulling this together, all of my colleagues who have been leading on this issue and are making sure that we are putting forward real solutions, and happy to be a part of that process and supporting these real solutions to make a difference in Californians' lives. Thank you.
So with that, I want to thank all of my colleagues for their leadership. As you've heard, there are over 25 bills introduced by Democratic legislators this year alone to confront this epidemic at every level. And when we say comprehensive, yes, that means because we need treatment, we need emergency response and intervention. And when we talk about stopping the supply, let's actually do things that are evidence-based. Let's stop the folks who are trafficking these larger amounts into our neighborhoods and communities. That's where Democrats are focused. We're not focused on stunts. We're focused on leadership and solutions. The tens of thousands of Californians who have lost loved ones to this deadly epidemic deserve leadership, and they deserve action. And that's what we are here to recommit to. So I want to open it up if there are questions. I do want to say, you've heard, I'm the chair of our Select Committee on Fentanyl, Opioid Overdoses and Addiction, and we are having our hearing on fentanyl on May 24th. It is a joint hearing with Public Safety and the Health Committee, and that will be a further opportunity for us to come together around solutions and action. This is impacting every single community in California, and we need leadership and we need action, and that's exactly what we're doing. Questions? Sure.
It might be impossible to know at this point, at least from my standpoint. I don't know if you know about the budget. Are you confident the governor will, support what you're here talking about today in the budget? I know we don't know what it's going to be. How are you feeling about that?
Well, we are all committed in making sure that we not only pass these bills, but that we invest in solutions in our budget. We're not spending enough on treatment. We're not spending enough on access to Narcan. We're not spending enough on access to emergency responders. And so we hope to work with the governor and our respective budget leadership to make those investments. And I know that all of us here are going to make that a top priority as we go into the budget conversation.
Thank you for that question. As I shared in my comments, one of the things that just scares the hell out of me as a mom is the prevalence of fentanyl on social media platforms. And so we've been really focused on action there. And I have a bill that is moving and is going to be voted on in the Assembly. And we're ensuring that we get our tech companies, our social media companies to step up and be part of the solution and help make our online environments a safer place for our kids. Thanks.
All set?
Thank you. Oh, geez. What? Hold up. Something's blowing. All right. Good work. I've got my